Are you awake? That's fine. You don't have to answer me for now. Let me just make sure that you're alive. Don't mind me talking to you, by the way. You must be pretty disoriented and scared. So I'm gonna tell you everything I'm gonna be doing before I do it, just in case you're actually conscious. Okay, first, I'll check for a pulse. Good, it's there. A bit faint and definitely too fast, but I can work with that. Next, let's make sure you're breathing. Nice, I can see your chest rising. Good to know you're alive. I'll reassess your consciousness level now. It would be good to have you awake and alert. I'm holding your hand now, so try to squeeze it if you can. Nothing so far. Alright, let me try this one last thing. I'm gonna press down on your sternum hard with my knuckles and rub. It's pretty painful without causing any drama. Ah, that did the trick. There you are. Hey, calm down. I'm a medic, and I'm here to take care of you. Don't try to move too much, darling. You're hurt pretty bad. And I'm sorry for the rude wake-up call, but I need you awake for this next bit. Can you tell me your name? Okay, nice to meet you. I'll do a quick neurological exam, but the fact that you answered me just now is already a good sign. Just follow the light, to the left, to the right, up and down. Okay, all normal. Next, I'll take a look at your injuries. I see a lot of cuts and bruises, but I'm most worried about this gash on your leg. It's bleeding quite heavily. It's actually impressive you were able to regain consciousness considering the blood loss, so good job. We have to control the bleeding and do it fast, so bear with me, okay? I'm gonna apply a tourniquet, which will hurt like hell, but you've already lost a lot of blood, and your system won't be able to compensate for that much longer. I'll give you some pain meds afterwards. Deal? I need to cut away your clothes so I can get a better view of the injury. Okay, that's done. I'm putting the tourniquet on now, okay? It's basically like a belt. Let me just get it as tight as I can. Yeah, shh. I know it hurts. You can squeeze my arm if you want to. I can take it. Okay. Let's take a little breather. I can't have you hyperventilating. I know you're in a lot of pain and I'll give you something for that soon. I promise. Just try to focus on me now and remember to breathe, alright? Now, are you okay to continue? You're doing really well. It'll be over soon. No, I'm not done just yet, unfortunately. The bleeding has slowed down somewhat, but you're still losing too much blood too quickly. I need to tighten the tourniquet by twisting the handle. Hey, keep breathing, okay? Just try to stay with me. Don't close your eyes. Hey, look at me. Keep squeezing my arm. I'm almost finished. Okay, that's it. The bleeding has stopped. I'll secure the handle, and then I'll get started on those pain meds, alright? The worst part is over now. You did good. Hey, are you still with me? I can see those eyelids drooping. Try to keep them open. Here, I'll make it worth your while. Let me just prep an IV for you. Can you tell me your favorite animal? Yeah, take your time to think. I'm just gonna disinfect your arm in the meantime. Anyway, I know the animal question might seem dumb, but if you want to keep patients conscious, it helps if you keep them talking. Also, I do like animals. Alright, keep your arm straight for me. You're gonna feel a poke, and there we go. The meds should kick in pretty much immediately. I give you the strong stuff. What is it? Everything alright? Ah, yes. Your favorite animal? Sure. So, what is it? Huh, good choice. When's the last time you saw one? Yeah, just think it over while I wrap up your wound so we can start moving you. Huh, you sure are taking your time. I didn't expect this to be such a hard question. Hey! Damn it, you're fading quickly now. Well, to be expected, but I'm already going as fast as I can. Hey! I need a stretcher over here. Patient with deep wound on their left eye. I was able to stop the bleeding with a tourniquet, but they lost a lot of blood. They were awake and alert up until a few minutes ago, but are now unresponsive. We'll have to move fast. Hey. I don't know if you can still hear me, but you're gonna be fine. We'll get you in an ambulance now and take you to the hospital. You'll probably need surgery, but they should be able to save your leg. I'll be with you as long as I can, okay? Here, I'm squeezing your hand again. Can you feel that? Yeah, we're en route now, about 12 minutes out from the hospital. Patient with deep wound on the left eye. I was able to stop the bleeding in the field with a tourniquet, roughly 15 minutes ago. Yeah, I'm worried about that too. I estimate they lost around 1.5 liters of blood, considering how they're starting to show early signs of shock. We've got them hooked up to the monitor now, and they're hypertensive with an elevated heart rate. Oxygen saturation is also a bit low for my taste. Just be ready for us when we get there, okay? Whoa. Did you just move? Are you awake? Hey, easy. Don't try to sit up. We've done this before, remember? I'm a medic. The one who saved your life a few minutes ago, actually. I'm still trying to do that now. I told you I would stay with you, didn't I? Hey. Calm down. I know you must be pretty disoriented, and to be honest, I didn't think you'd regain consciousness. It's a good sign though. Means your brain is getting more oxygen again. So, good job. You're doing great. We've controlled the bleeding and we're giving you fluids to help with your blood pressure. We're also monitoring you closely, and the hospital is ready for your arrival. How are you feeling? Dizzy and cold? That makes sense. You lost a lot of blood. I'm afraid I can't help with the dizziness, but I can get you an extra blanket. Here you go. Are you in any bad pain? Yeah, your leg. The tourniquet has to stay on tightly for now. But here, I can give you some more pain meds. I'm afraid it won't be enough to get rid of all the pain though. I can't risk sedating you too heavily while your breathing is already this labored. I'm sorry. Still, it should help a bit. There. You should start feeling better any second now. No. Now is not the time to close your eyes, okay? We just got you back. Please just try to hold on. Just focus on me and take some deep breaths with me, alright? In and out. In and out. Perfect. That's perfect. You see that blue number on the monitor? Up there in the corner? That's your oxygen saturation. It just went up a bit. Good job. Keep concentrating on your breathing. I'm right here with you. While I have you, I'll just check you for further injuries. Would that be okay? Let me pull up your shirt a bit to check your chest. Alright. I don't see any obvious injuries, and your ribs don't seem to be broken either. I'll move on to your abdomen now, and apply some pressure right here. No pain? That's good. Means we might get lucky and won't have to be worried about any internal bleeding. Okay, I'm done with the exam. Good job. Here, I'll put the blanket back on. Ah, and by the way, you still owe me an answer from before, remember? You don't? Well, you did pass out pretty much immediately after I asked, so I'm not surprised. Basically, you told me your favorite animal, and I just wanted to know when you had last seen one. So? Ah, I see. Lucky you. Yeah, I like them too. They're cute. Hey, what is it? Your heart rate just went up. Is everything alright? Is the pain getting worse? Are you breathing okay? Shh, shh. Hey. I know this is scary. Here, I'll hold your hand again, if that's okay. Is there anything specific you're afraid of? What's gonna happen to you when we arrive at the hospital? Yeah, sure. I can tell you about that if it'll ease your mind a bit. Okay, so first, we'll do the handover with the doctors and nurses from the emergency room. They already know you're coming and are waiting for you. They'll probably want to start with blood transfusions right away, which should make you feel a lot better. We have been giving you fluids to help compensate for some of the blood volume you lost, but those don't have the same effect as actual blood, of course. To do that quickly, they might have to set up a second IV in your other arm too, just so they can get you what you need more efficiently. It'll pinch again, but the first one wasn't so bad, was it? I'll have to think what happens after that. It's not really my specialty. Oh, yeah. In the meantime, they will check you for other injuries, like I just did, but they'll use way cooler technology, like ultrasound, not this amateur hour over here with just my hands. After that, I think they will start prepping you for surgery to... Hey, what's going on? Your heart rate just spiked. Are you scared of the surgery? I get that, but you really don't have to be. The anesthesia will actually feel nice, I suppose, given how much pain you're in right now. And the best part is, they'll do all the work for you. You just have to lie there and sleep while they fix your leg. And when you wake up, you should feel much better, I promise. Shh. Everything will be fine, alright? Hey. Your oxygen sats are dropping. Do you feel like you're getting enough air? No? But that's okay, we can help you breathe. Here, let me put this oxygen mask on you. Hey, keep taking deep breaths for me, okay? We're almost there. Stay with us. You're doing great. Hey, how far are we? They're about to lose consciousness again, and their breathing is getting way too shallow. 4 minutes still? Shit. Okay, just keep driving. I'm prepping an intubation kit just in case. Hey, I'm still here. You're in good hands, okay? I'll keep taking care of you. I promise. Hey, stay with me. I know you're exhausted, but I need you to keep breathing for me, alright? Just focus on my voice. Here, I'm turning up your oxygen. This should help. Take slow, deep breaths, okay? In and out. That's it. Just keep going, okay? No. Don't close your eyes. Look at me. Hey, hey. Come on, stay with me. Talk to me if you can. Just a word, anything. Hey, wake up. Shit. Your oxygen levels are still dropping. I need you to fight this, okay? Keep those eyes open. Keep breathing. Damn it. You're barely getting air in now. I'm switching to a bag valve mask. Alright, I'm helping you breathe now. Just let me do the work. That's it. Stay with me. We're almost there. How close are we? They can't hang on much longer. 2 minutes? Okay, just keep going, don't slow down. Come on, I need you to hold on. Squeeze my hand if you can hear me. Just a little squeeze. Anything. Shit, no response. Heart rate's dropping. The team at the hospital should be ready to intubate the second we pull in. Patient, severe blood loss, worsening hypoxia, blood pressure dropping, no response to verbal stimuli. Hey, can you hear me? I know you're barely hanging on, but we just made it to the hospital. You're safe, and you've got a whole team waiting here ready to take care of you. This is where I leave you, for now. Just try to hold on. We've made it this far together. Don't go dying on me, understood?
Let's get him on the bed. Moving my count. 1, 2, 3. Alright, honey. Can you open your eyes for me? Just a little. Good. I see you trying. I know everything feels like it's slipping away, but you're not alone, okay? We've got you. You've lost a lot of blood and your body is struggling to keep up, but you're doing well. Try to hold on a little longer. We've got you on oxygen, but it's not going to be enough. I'm setting up a second IV now so we can get more fluids into you. Here, I'll let you know before I do anything, but you might still feel it. Alright, I'm finding a vein. There. You'll feel a pinch. Good. It's in. Team, let's get that first transfusion going. Hey. You're gonna get your first unit of blood now. You might feel a little warmer. No worries, that means it's just working. No, hey, I just felt you squeeze my hand. You're still with us, that's good. It's really good, actually. I know it's getting harder to keep your eyes open. You can rest, but don't just let go yet, okay, hon? The biggest problem is gonna be your leg. We stopped the bleeding, but we can't leave the tourniquet on forever. They're getting the operating room ready for you right now. In the meantime, we're working hard to stabilize you for the surgery. Alright, let's see what's happening. Team, their breathing's getting even shallower and their oxygen levels are dropping. They're barely getting enough air in on their own. Listen up. We have to make the airway a priority. What's their oxygen stats now? 81%? That's it? We can't afford to wait any longer. Let's prep for intubation. Alright, listen on. We need to help you breathe better. You're barely conscious and your oxygen levels aren't improving. We're prepping you for intubation now, okay? Simply means we're gonna sedate you. It'll feel weird at first, but we have to make sure you'll be asleep through the worst of this. I'll be right here the whole time. You won't feel a thing, I promise. And when you wake up, this will just be another bad day of the week, okay? Alright, pushing meds now, team. Let's bag them while we wait for the paralysis. Hey, if you can still hear me, hope you know you're safe. You've done a great job. Just rest now and close your eyes, hon. Pro's got everything handled on our end. Alright, they're out. Breathing tubes going in now. Okay. Got it. Tubes secure. Good breathing sounds on both sides. Good news. We just hooked you up to the ventilator. That should help take some of the strain off your body. You must have been fighting so hard. We won't have to do that type of struggle anymore. We'll do the rest of the work for you. There we go. Your numbers are already looking a little better already. And look at that, just in time. EOR is ready for you now. Tourniquet's been on long enough. We need to get control of that bleed and repair this damage. We're taking you to the surgery now. You're gonna be okay, hon. You can trust us. Alright, team, let's go. No delays.
Alright, we're almost there. You're doing great, honey. Just a little further. Okay, we're in the OR now. Different team, same goal, taking care of you. We've already got your breathing tube in place, so that part's done. They're giving you medication to keep you fully asleep through the surgery. No pain, no awareness, just rest. You might feel something cool in your IV now. That's the anesthetic going in. It's gentle. Just let go, honey. We've got you. Your heartbeat is steady. Your oxygen levels are good. That's what we like to see. Alright, we're all set on my end. You can go ahead and get started. Let's save this leg.
Hey there. You're waking up just like we expected. The surgery went well, and you're in the recovery room now. If you're up for it, you can try to open your eyes. Take your time. There's no rush. You might feel disorientated and groggy, but that's normal. You've been asleep for a while, and the anesthesia hasn't completely worn off yet. Oh, shh. Everything's fine. No need to panic. You still have a breathing tube in. That's why you can't talk. But since you're breathing on your own now, we're getting ready to take it out. Hold on for a moment. Alright, we're ready when you are. I need you to take a deep breath in for me. And when I tell you, I want you to cough. Let's get started. Deep breath in. And cough. That's it, that's it. The tube's out. You're doing just fine. Slow breaths now. Here, let me sit you up a little. Your throat will feel sore for a while. That's normal. Yes? Oh, about your leg. The surgery was a success. You're not out of the woods yet, but we're optimistic. Can you tell me how much pain you're in? 0 is no pain. 10 is the worst pain you can imagine. Okay. You don't have to push through it. We can help with that. Here you go. You should feel better in a moment. The meds might also make you drowsy again, but don't try to fight it. Your body needs time to recover. That's it. Just close your eyes. You can rest. We'll take care of everything.
Oh, did I wake you? Oops. It seems like you're trying to open your eyes. Wait a moment. Let me turn down the lights a bit. I'm sorry, I didn't mean to wake you up. I just kind of grabbed your hand without thinking. It's just... the last time I held it, it was so cold and lifeless. Letting go of it when they wheeled you into the trauma room felt impossible. Also, I don't know if you even remember, but I'm sorry for saying that stuff about you not being allowed to die. That can't have been very helpful to hear. I was worried about you. And I just couldn't get the image of the last time I saw you out of my head. You on that stretcher surrounded by a bunch of doctors and nurses. I'm pretty sure you stopped breathing at some point. I can still hear the sounds of the alarms going off everywhere. I really wasn't sure whether you were gonna make it. Anyways, you did. I felt so relieved when I heard. And your doctor even told me that you should regain full use of your leg. That's amazing. Hey, are you cold? Sometimes people feel cold when they wake up. Here, let me tuck this blanket around you. Huh. That just gave me deja vu to when I wrapped that blanket around you on our ambulance ride, remember? That ride was so tense. I think my driver actually broke a few traffic laws because I kept yelling at him to go faster. And you were so out of it, but still tried to answer all those stupid questions I kept asking you to keep you from passing out again. I think I even asked you about your favorite animal at some point. Oh man, real creative on my part. I'm sorry. I should probably stop talking about myself. How are you feeling? Better than when you last saw me? Well, I would hope so. You were actively dying that time, so the bar is pretty low. But seriously, I can't imagine what these last few hours must have been like for you. Should I leave? I don't want to keep you from resting or anything. Here, I'll leave right now. Huh? Well, now you're the one who doesn't want to let go. But yeah, of course, I'll stay a little longer. Holding your hand is much nicer when it's actually warm and I'm not watching you bleed out. Oh, I almost forgot. I didn't actually come here just to hold your hand. I brought you something. I couldn't believe my eyes when I saw this at the gift shop. I just knew I had to get it for you. Here you go. It's Band-Aids, and they've your favorite animal on them. Oh, I think that's the first time I've seen you smile. Wow, that was definitely worth it. Guess my questions weren't that pointless after all. I can see you're struggling to keep your eyes open now. Kind of a familiar sight by now. Shh, no, you don't need to fight it. Just this once, I won't yell at you to keep them open. It's okay if you fall asleep. You made it. We made it. I'll keep holding your hand until you're out, okay? I'm not going anywhere.